Namaste. Good morning, and welcome to our continuing series on homeopathy with our beloved Dr. Pachegaonkar. Namaste, sir. We have covered many subjects, especially for men, and today we'll begin with women's health. I think it's a good thing to start with. So, shall we start with the menstrual health?
Yes.
Good.
See, each female goes through a childbearing period. Roughly around 12 years of age, the female starts menstruating
Mhm.
up to the age of 50-55. These menstrual cycles physiologically are because every female has ovaries where each month there would be one ovum which will get matured, and once it is matured the Graafian follicle ruptures, releasing the ovum from it. And once the ovum is released, and if it doesn't get fertilized with male gamete, the preparation in the uterus to receive the fertilized zygote is not utilized. So once if it is not fertilized, after 14 days the uterus desquamates it. The preparation for receiving the conceived zygote is discarded or cleansed, and that desquamation from the uterine mucosa comes out in the form of menstrual bleeding. Generally, the cycle is 28-day cycle, but 25 to 32 days cycle
It can
would be a
vary,
normal
yes,
interval.
yes.
In about 4 to 5 days on an average, the desquamation, the bleeding occurs per vagina. That bleeding can be 60 ml to 100 ml in 4 to 5 days on an average. However, we have females who menstruate only for 3 days flow or even up to 7 days. It's considered to be normal. We always calculate the interval from first day to first day, not after completion of bleeding. First day to first day is what we call, it's a right interval we calculate. And it's a physiological phenomena during childbearing period. Initially in girls attaining puberty, 3 to 4 years, those cycles are anovulatory cycles, where it is just a preparation of uterus and ovulation is not there. And these anovulatory cycles, where the ovum doesn't get matured, the Graafian follicle doesn't get matured, and it's not released.
But there is bleeding.
There is bleeding. So it is quite likely that it may be little irregular, not necessarily like 28 days, but once the ovulation starts, the cycles become very regular. And it's a physiological phenomena, and females really feel, they realize the hormonal changes they go through, the ovulation and desquamation in the form of menstruation. And therefore, the health of the females is indicator that the female generative organs are functioning in a healthy manner. So menstruation is mainly that, but once the zygote is there, like conceived, the ovum and male gamete unite together to form a zygote, then the menstruation stops. Because then the uterus is geared up for harboring that zygote through what we call pregnancy, and that goes through up to 38 to 40 weeks to mature. And once there is a delivery of the conceived baby, then the female has to nurse the breastfeed.
Yes.
And there, after the delivery, the female doesn't menstruate immediately. The ovulation doesn't place, not even menstruation. And that is what we call a physiological amenorrhea because of lactation.
Mm-hmm.
So many females, after delivery, they don't have menstrual cycles for 6 months to even 1 year, even up to 18 months. They don't have menstrual cycles. And if at all cycles are there, they are anovulatory for a while till the lactation is in full form. So menstruation is really a boon to females because every month they have lot of crises to get the ovum zygote, and then it is desquamated. So it's a sort of a catharsis. So many females we find that they feel much relieved and much healthier, much elated once they menstruate properly.
After the menstruation or
Yes,
during?
even with the very start, very beginning
Mm-hmm.
of menstruation, they start feeling well, feeling relieved.
Now, we have many other subjects to cover, but I don't think we'll be able to do all of them today. Next week we'll do another because I want to ask you about pain during the menstrual cycle. A mother has spoken to one of her disciples, one of her children, who was very close to her, and mother said, there's nothing to it, really. But I have known in my own life with my wife going through severe pain. Could you talk to us
in,
about
in,
that?
in dysmenorrhea, we call it dysmenorrhea. It's a painful menstruation. So there are two types. One is primary dysmenorrhea or membranous dysmenorrhea, and secondary dysmenorrhea. Primary means it's sort of a neuralgic pain which may start little earlier to menstruation. See, we say onset of menstruation only when the blood appears per vagina.
Mm-hmm.
But in reality, the desquamation process starts much earlier in the uterus.
Oh.
So the females, especially the young girls who have attained puberty with primary dysmenorrhea, they get agonizing, severe spasmodic pain. And this pain we cannot treat with more hormones because that's harmful for the generative organs. So nothing should be done
They
in
have
a
to go
what we
through
call
it.
aggressive manner. They have to go through it. But homeopathy has certain remedies where they can bring this sort of pain within the pain threshold of the adolescent girl, and they start bearing the pain, and they are able to bear the pain. That is what we can do. In secondary dysmenorrhea, mainly it is because of endometriosis or inflammatory disease around the generative organs. So in pelvis, there is sort of an inflammation, and that inflammation can give rise to severe pain that should be treated or that can be treated. Again, endometriosis is something which really gynecologists are scared of. Basically, it is very difficult to diagnose. But however, clinically, if you diagnose, earlier they used to even create artificial menopause with hormones to treat endometriosis. Homeopathy has wonderful remedies based on symptom similarity we give, and the pain is elevated.
Alleviated.
Yes.
I see. Oh, well, thank you so much. That's